Hi, it's Dr. Ann Metz, and this is the Psychedelic Skeptic, where we believe nothing is the cure for everything. If it's your first time here, I'm a licensed therapist, counseling professor, and in fact, a psychedelic therapist. But I'm also a skeptic when it comes to some of the claims around psychedelic medicine, and that's what I'm here to explore. Today on the show, what has the psychedelic renaissance meant for Indigenous communities?
With the case of Mazatec community and Maria Sabina, who was the most famous Mazatec wise woman. She called herself a sabia, and her knowledge and wisdom were to cure people with the help of the psilocybin mushrooms. But then after she became, against her will, hugely popular, and everyone from counterculture in the 60s that had a name was going down to Oaxaca and trying to get in to see her and have one of her mushroom ceremonies. But that ended up really devastating her life she really, it did not fare well. And she felt like she expressed many times that she felt that she lost the connection with the sacred mushrooms. So this need to protect and not trivialize the ritual forms is very much underlying the current efforts to maintain resources, the autonomy over their ancestral lands, which of course are threatened in all different kinds of ways.
My guest today is Dr. Melissa Frost. Dr. Frost is a Spanish professor at the University of Virginia in Charlottesville, Virginia, my undergraduate alma mater. She holds a PhD in Spanish from the University of Virginia and has been teaching translation, literature, and language courses there since 2010. This conversation is likely one of the most important we've had on the show. Living in New Mexico, on the ancient, modern, and contemporary land of the Taos Pueblo, these issues are near and dear to my heart. I often struggle with how to properly address issues of Indigenous reciprocity in my own clinical work, as well as how to distinguish between cultural appropriation and cultural appreciation. And Dr. Frost does a marvelous job of helping clarify the difference. Dr. Frost's research focuses on the history of hallucinogenic plant consumption in colonial Mexico, examining pre-Columbian codices, colonial texts, and contemporary ethnographic studies. Her knowledge of policies affecting present-day Indigenous communities will provide some vital context for our discussion. Just to let you know, this will be my last show for a few months. I'll return in the winter with a new season of interviews, but I hope that you enjoy this one. I know I did.
All right. Well, Melissa, I'm really curious. How did you become interested in psychedelics as a research subject?
Well, that's a really good question. So that goes back to my grad student days when I was here in the Spanish literature program at the University of Virginia. And we were in a class about just the colonial period in general, talking about first encounters between Europeans and Amerindians. And the question came up about basically communication between, in this case, the rulers of the Mexica, or otherwise known as Aztec Empire, and Hernán Cortés, the conquistador. And it just dawned on me that one of the topics that was underappreciated, as far as I had seen in existing scholarship, was how different communities negotiate the question of psychoactive substances, how they're used, how they're categorized, what is allowed, what is prohibited. And when two communities with vastly different practices regarding psychoactive substances meet, what kind of realignments, adjustments, negotiations, in some cases, what kinds of violence happens in those encounters? So I was really interested in finding out, especially knowing in the context of Mexico and Mesoamerican pre-Columbian cultures, that there were a lot of psychoactive plants that were of primary importance in terms of the sacred. So based on that, and just I'm a huge history nerd. I love history, and especially thinking about the colonial period. So I started looking into what does the record say about how those first encounters played out? Who were the stakeholders? And especially in terms of the Catholic Church, of course, so there was a lot of conversion efforts happening at the time with the indigenous communities. All of those efforts were very much affected by the existing practices amongst the communities in the Americas. And in terms of my particular expertise and focus in central Mexico. So I was just really curious about how that played out and then how the results of the legal structures of the colonial period when it came to prohibition, because that's really what happened, is especially with kind of the most famous psychoactive plant. So we can talk about peyote, for example, was prohibited emphatically as of 1620, right? And what happened to people that were using peyote? What were they using it for? How were they tried by the Inquisition? So all of that is just really fascinating to me. And then thinking about how those processes have informed how the legal structure is in present day Mexico. And now that we're on, in the uh, beginning of this psychedelic renaissance, as it's been called, what happens to the communities that are still affected by those legal parameters?
Wow, I had no idea that peyote was outlawed that long ago. Could you talk a little bit about that particular moment in history of when that happened and why that happened and what that looked like?
Sure, absolutely. So there is this gap, right? Because we got 1492, Columbus arrives, and then the conquistadors, including Hernan Cortes, of course, at the front of that effort, arrive to Mexico. And in that particular, let's say the first 30, 40 years, there is very little textual evidence in the archive about these, any kind of psychoactive substances or what would be considered sacred substances. Peyote, morning glory seeds. There's a species of tobacco that was also highly hallucinogenic, highly psychoactive. But I'm talking about the heavy hitters here that did eventually end up on the radar, but there are dozens of psychoactive plants that had long traditions in the Mesoamerican context. But of course, for those first 20, 30 years, they were not really detected or perceived because, and this was my original work on my dissertation, was that in the European framework, these plants did not fit anywhere, right? There were psychoactive plants in Europe. We're talking about henbane and belladonna. So there was remnants and a very comparatively small tradition. And of course, that was also very much underground and associated with witchcraft, right? And so then in the Mesoamerican context, when these plants were used abundantly, psilocybin mushrooms, also another example. But they simply didn't fall within the context that the Spanish understood. So when you look at the archive, especially the Inquisition, the trials, you can see through the European lens that what they perceived was drunkenness, right? Everything was categorized as drunkenness because they could not distinguish between these different plants, their uses, the sacred context, the ritual context. And then, as the colonial project marched on, by the end of the 16th century, beginning of the 17th century, what was really happening was that the use of these plants was spreading from the indigenous communities into non-indigenous communities. And that, of course, was raised the alarm for the Catholic Church because, of course, what they were trying to do was to eliminate what they categorized as idolatry. So seeing that these practices were on the rise amongst like the Spanish caste and the there was a caste system in colonial Mexico. It's a whole nother topic, but very related to this because that's really what raised the alarm, and the church started looking into it and prohibited peyote explicitly, but there were other plants that they had their eye on as well. And eventually, but it took about really 100 years into the colonial period for the prohibition to really go into effect.
Interesting. I'm wondering as we're talking, and I know that this might require a lot of generalization, but I'm wondering if you can maybe provide an overview about the traditional use of psychedelics or psychoactive substances in indigenous communities in Mexico.
Yeah, so it is a little bit difficult to go into because each community has their knowledge, their relationship with different plant medicines, and they have different functions, different symbolism. But I can speak to, for example, according to the historical record in Mesoamerica, and there were one of the good things is that there was this uh, impetus to record this pre-Columbian Mesoamerican knowledge, and that was primarily done by a gentleman by the name of Bernardino de Sahagún, who is called like the father of ethnography because in academic circles because he really did a thorough catalog of the different plants and what they were used for and resisted from many chroniclers of that period would immediately call something like demonic as opposed to just describing it. And he did the best job in just describing things as they were. And that catalog of customs, knowledge, plants, the cycle of feasts amongst the Mexica, which they had a very, oh gosh, exciting and extravagant. I don't know if extravagant is the right word, but there was always a big public feast going on in their cycle of feasts. And so all of that is documented. And there were different plants, different psychoactive plants that were used in those ceremonies. Some of the most frequently used were Teonanacatl, which is the Nahuatl word for the psilocybin mushrooms, but it was actually a few different kinds of mushrooms that they would categorize with that name. So it was more the function as opposed to the particular species.
Mm.
And those were used in all kinds of contexts. According to Sagun, they were used to kind of cement the bonds between different like tradesmen. Like it was a way to encourage just camaraderie. And of course, there were also what we would categorize as the medicinal category or medicinal use of especially the psilocybin mushrooms. But if we're going to speak in most generally, like if we think of a line that connects the ritual use of psychoactive substances across substances, we could say that it comes from a need, a question, usually related to an illness, however that's categorized. During the colonial period, it was really interesting because there was this mix between European kind of desire for the divinatory arts, which was common in Europe at the time, to go to a necromancer and find out where your missing husband was.
Mm.
And in the colonial context, that actually manifested, but through the use of, for example, peyote or morning glory seeds. So there was like a syncretism, a hybrid development of use of these substances. And kind of the two categories that became most common were for healing purposes. There were a lot of questions that came before the Holy Office of the Inquisition that were regarding, is it a sin to use peyote medicinally as opposed to for divination? So that was
Mm.
the first split of what could possibly be acceptable medicinal use versus using it to find out where you're missing items of value, missing people. They would go and try to find out because the idea was that it would expand your vision and your problem solving skills. Really, that's what it was, is they would use it for practical, almost like problem solving. But that was during the colony, and before that, it's hard to say, to kind of categorize uses in the same way that we would categorize, as I was saying, like medicinal versus sacred ritual, right? Because it was all the same, in the
Mm.
same vein, and we would never speak of recreation, right? In that context. Yeah.
Interesting. I,
Yeah.
a few years ago, sat in on a third generation Mazatec medicine woman did a ceremony,
Wonderful.
and I saw it, and it's such a different experience than what I was expecting because it did, and I've only thought of this now that you mentioned it, it did start with this question. And for the woman who was experiencing the ceremony and allowing us to observe it, her question was like around fertility issues and wanting to become pregnant and sort of seeking the wisdom of the mushrooms to help answer that. Is that what you're describing?
Absolutely. Yeah.
Okay.
And the question can be, again, about, seeking that answer, the relief, but also very much in the healing sense. And I mean, what we might say in terms of like mental health and mental well being, but it usually comes from that question or that anxiety.
Mm.
Yeah.
So it sounds like there is some overlap and then some divergence from how psychedelics are being used now, how we're hoping they're going to be used in the future. Could you talk a little bit about where you see there is alignment and divergence?
Um, yeah. It, I think when we consider the state of things as they are, and we think about the recent context of psychedelics and the counterculture of the 60s and 70s, and how that, in a sense, trivialized psychedelics in a way that I think is the concern that at least I've seen from colleagues that are doing more of the research side of clinical trials and what have you in terms of therapeutic uses, is that there wants to be kind of there is a separation, this desire to separate from the idea of the counterculture. But what I find interesting is that there were so many dimensions to what falls into that counterculture bucket, and the acknowledgement and appreciation of the indigenous perspective and knowledge was wrapped up in that counterculture, even though in many cases, in the case of the Mazatec community is definitely one, there was an eventual resentment of how much attention the use of their ancestral knowledge, like how it affected the community, because it brought people from all over the world that were just living in their communities, just wanting to consume psychedelics,
Mm.
as kind of a lifestyle, which it was never intended to be that way. It is a tool, a healing tool, right, in terms of the use in the Mazatec sense. So what I see now is this movement towards understanding and embracing the complexity of those questions, that the indigenous perspective and knowledge, and we can't just speak of one, we need to speak of multiple, but that those voices and the value of the knowledge that they bring need a seat at the table, and not just because there's a need for reciprocity for the communities that have been the stewards of that knowledge that has led to more modern, or not, perhaps not modern, but present day scientific discoveries of the benefits of psychedelics. So that was a very roundabout way to get to the yoke of your question of what the biggest, the most important use that I've detected in my archival research comes back to that, the need to answer a question, a burning question, whether it's related to health, whether
Mm.
it's related to other kinds of well being that is not being addressed by mainstream or sanctioned medicinal practices. And what I see, for example, I have this great case of this Spanish woman, and she implicates all the elite of the Spanish colony. I mean, this was very scandalous that she was taking a mysterious herb by the instruction of an indigenous, she didn't even name who it was, but an indigenous man had given her this herb. And she had these amazing visions that she describes. And this is from 1635, the case is from. And and one of the things that she explicitly says is, he did for me what the doctors could not.
Mm.
Because it turns out that she had been very sick for many years, and then through the use of this, which was clearly a psychoactive substance, she was somehow miraculously cured. And of course, there's a lot to say about the archive and questions about whether you can take it as accurate or not, but certainly a pattern of these psychedelic substances being effective
Mm.
and helping people in situations where they had turned to other forms of medicine or even in some cases religion and had not found something to help them. So I see that parallel
Mm.
where there seems to be this interest in psychedelics as a way to address ailments that perhaps have not been either sufficiently or it needs to be complementary with current practices.
Mm. So it sounds like the, intention setting piece, that question that we might ask at the beginning, and then also the kind of sense of desperation and the lack of great answers from traditional medical establishment, which certainly I think explains a lot of the hope and enthusiasm that people have for our psychedelic future. Is just that the alternatives that we have for so many psychiatric conditions are not great at best.
But
Yeah.
I do think it's really interesting to think though that that, and I firmly believe that it's a tool. Psychedelics are a tool, but they're not necessarily the best tool for every situation, right? Because
Mm.
they have been around literally forever. And when it comes to the human experience, and they're important and helpful and and play central roles, especially in a lot of healing traditions. But I think especially like the topic of your podcast is really important because these are questions that need to be asked and prodded in those different ways.
Mm. Well, I am obviously inclined to agree with you. As you were describing kind of the history of psychedelic use and psychedelic tourism, it made me wonder, how are a lot of indigenous communities responding to the interest from the US, from Western Europe, in terms of their traditional healing practices?
Yeah, absolutely. So I think every community and within each community, they're going to give different answers because there are. So if we think about the Wirarika community, also known as the Huichol community, present day Mexico, they are stewards of the peyote knowledge, right? And they do their pilgrimage every year that's obviously been very affected by just everything, modern development, etc. So they there are people in the community who believe that that knowledge needs to be kept in the community. And there's also those who feel like it should be shared. So those opinions are going to vary from community to community, and also within the same community there might be different ideas about it. But in general, in Mexico, just thinking about peyote is a finite
Mm.
resource. So the more demand there is for peyote, it starts affecting the ecosystem. They can't find the peyote um, is becoming harder to find in the desert. Just all kinds of things are affecting it. So that kind of degrades their way of life and their ability to practice their traditions. So of course that's going to be a point of contention. But there's so much going on, and using the Wirarika community as an example, there's communities that have now changed to urban settings that are kind of separated from their ancestral land, and their form of adapting, it's all the communities are living and changing and adapting, right? So there's always different opinions on it, but in general, the need to preserve the many times finite and on the verge of endangered resources connected to traditions, that's a huge point. And then also the knowledge itself and the relationship with the plants. Because, for example, with the case of Mazatec community and Maria Sabina, who was the most famous Mazatec wise woman. She called herself a sabia, and her knowledge and wisdom were to cure people with the help of the psilocybin mushrooms. But then after she became, against her will, hugely popular, and everyone from counterculture in the 60s that had a name was going down to Oaxaca and trying to get in to see her and have one of her mushroom ceremonies. But that ended up really devastating her life she really it did not fare well, and she felt like she expressed many times that she felt that she lost the connection with the sacred mushrooms. So need to protect and not trivialize the ritual forms is very much underlying the current efforts to maintain resources, the autonomy over their ancestral lands, which of course are threatened in all different kinds of ways.
Yeah, absolutely. I'm curious if, and if the answer to this may be absolutely not. Would you say that there are any ways that communities might be benefiting from an increased interest in psychedelics?
Yeah, it's a good question because, and going back to Maria Sabina, who's the prime example of that, the effort started out as reciprocal, right?
Mm.
Because she was working with a few different people who were bringing health centers to the area. And the idea was always one of reciprocity and benefit for the community. So currently, in the scholarship that is coming out regarding the psychedelic renaissance and the question of Indigenous knowledge, there's a lot of work being done on developing these structures, these guidelines for reciprocal relationships. Because with the sharing of this knowledge, the idea is that there should be something of benefit and also a way to respect those forms of knowledge in a way that's not going to hurt the community.
Mm. Have you come across any positive collaborations or partnerships between Indigenous groups and kind of researchers or organizations here in the US or in Western Europe?
I would say, for example, one great organization is the Shakruna Institute, and they work with communities and have developed like models for reciprocity. And there's a lot of people that work directly with, so for example, like activists in the indigenous communities, and it tends to include a holistic effort to address not just the kind of psychedelic element or some kind of acknowledgement and benefit based on that knowledge, but also just the situation that the community itself is facing, whether it's removal from their ancestral land, or in the case of the Wirarika, it's like mining that's affecting their territories and what have you. So it tends to be a combined effort that's going to benefit the community overall. And the psychedelic plant medicine is kind of is included in that, especially when it comes to the idea of psychedelic tourism,
Mm.
the increase in demand of these psychedelic experiences may lead to healing centers, as they might be called, or places where there's kind of a combination of all these traditions mixed together. So,
Mhm.
one place where you can go and take a psychoactive substance and then also go and maybe into a sweat lodge or something like that. And it's almost like a spread of different traditions all wrapped together and delivered. And that is it's usually not run by the community itself, right? So those things become problematic, and the communities I think are wary of that.
Obviously, there's a huge explosion of ayahuasca tourism, but I would say that Mexico probably has had one of the longest traditions of kind of psychedelic tourism. Could you maybe talk
Absolutely.
about that history?
Oh yeah, yeah, for sure. I It really did start with the Sierra Mazateca and Maria Sabina and Gordon Wasson exposing that knowledge and tradition to the Western world. That then there was this huge influx, and this was in the 60s and even the 70s, of people who wanted to experience the mushroom ceremony, but what Maria Sabina is quoted as seeing as problematic with that was that the mushrooms really were a healing tool. And most of the people, this huge influx of people, wanted to experience the level that would be equated to seeing God, let's say,
Mhm.
but not necessarily because they have a question or an ailment to bring, right? So it's the experience, but not as a healing process. And that the desire to experience, to expand one's vision, to look beyond, was not really seen as a legitimate reason to take these substances. I just read this really great article about Maria Sabina and her reciprocal relationships with doctors and psychiatrists, trained psychiatrists who came and experienced her mushroom velada and had other experience with psychedelics, and how they worked on developing kind of these parallel treatment forms that would encapsulate every part of the mushroom ceremony, but in a Western medicinal perspective, and simulations of different kinds for each of those effects. And even in that context, the idea was that there needs to be an intention, and whether that comes in the form of a question, but just to have the experience, just
Mm.
to open one's third eye, or however you'd want to describe it, was not seen as a legitimate reason, and in many cases could even be a reason why the experience would not go well, right? Is there's a lack of the intention or the clarity as to why you're embarking on this journey, looking for this experience.
Interesting. And I think that gets at some of the controversy around maybe around cultural appropriation, which is something I'd love
Mm.
to talk to you about. How do you distinguish between cultural appropriation and maybe cultural appreciation or respectful exchange?
Yes, and I think this is it's such a important and huge question, especially when talking about indigenous forms of knowledge and identity. Um, Mexico is a very complex place because most of the population is of very mixed descent from both the original inhabitants and Europeans, right? And even more so than here in the States. And that kind of manifests in the everyday experiences of the people. There tends to be more use of like folk or popular medicine and beliefs that still just exist through all walks of life. I mean, you go through Mexico City and there are businessmen in fancy suits getting blessings from medicine people in the Zocalo in Mexico City while they're on their way to their meeting, right? So there are so many strands of what that appreciation for those traditions, right? Whether they are psychedelic or simply indigenous traditions, it's really hard to piece it apart in the actual experience of people. And as someone, I am a descendant of the Crow tribe of Montana. I grew up in Mexico. I'm bilingual. We always had a lot of connection with several indigenous communities in Mexico. So it's a part of my identity, but I'm a scholar. My mom is a California girl. So I'm always grappling with this question of when we're thinking about who has the right to use medicines and who has the right to engage with knowledge, right? So this is something that I have to my very core. But I think when it comes to appreciation versus appropriation, it really has to do with the level of connection with the community itself, right? If you are respectful and approach the community and ask for the privilege really to either witness or participate in a tradition, that's the right way to do things. And you might be told no, right? You
Mm.
might be told no, which is fine. But the appropriation comes when in my view, when there's a complete, that it's severed, the connection with the actual community, the descendants of the community is not there. And in the absence of that connection and that conversation and that permission is where we can get really lost. I would hope for a psychedelic future where indigenous communities, whether their traditions are directly related to the particular psychedelic that might be developed into treatment, but that they are brought into the conversation and offered the opportunity to decide how they want to engage with these developments, with these treatments, with this research. And it really comes to that question of reciprocity. These reciprocal models really are, I think, the way to do that correctly. And having these conversations and consulting communities and community leaders whenever a question arises of proper use, of tradition, of permission.
So it sounds almost like there are a couple of different levels of it too. There's the big level of can we engage with this body of wisdom? And then maybe practical, there's a more practical level of like, should I bless the four directions of the wind before I start my treatment?
Sure. And I think so. I see a problem when bits and pieces are taken, right? So I noticed in Oregon where they're starting to do treatments, there was one profile that said, we incorporate indigenous traditions. What indigenous tradition? Again, we come back to this idea that indigenous is one basket that you can take things out of. And, that hanging a dream catcher in the therapeutic room when there's no other context or no other reference to it, but just because it holds some maybe certain symbolism for somebody, that's okay or should be
Right.
done. And I think that's really what it comes down to is um, having respect for the living, breathing people and consulting and as opposed to just taking those symbolic bits and pieces in order to create like a tone, right? Or
Mm.
something like that.
Yeah, I think that's actually really helpful. And I think one of the ways that I look around and look at the way people are presenting themselves as psychedelic therapists, it's just kind of this mismatch of new age spirituality that draws from this and draws from that. Um, and I don't know, there's a part of me that just wants people to sort of accept that you came through a clinical counseling, clinical psychology program, just like own that tradition rather than
Right.
trying to have it both ways.
Yeah. And there's definitely a long tradition, again, of more, we'd say, allopathic specialists trying to incorporate, like trying to break down, okay, the Mazatec mushroom ceremony. What happens? How can we break this down? And how can we recreate this in a little bit more of a Western context, right? And those there were mixed results with that. And then that's a whole history of how that happened in Mexico in the 60s, and they were there were all kinds of things going on. Psychedelics being used for torture in some cases, and truth serums and all that stuff that happened. And so I think all that to say that, taken out of context, and taking one part of the practice and changing everything else, it's not that it's problematic in the broader sense of, oh, psilocybin shouldn't be used because psilocybin comes from these mushrooms, and that mushroom ceremony belongs to the Mazatecs. But rather, if you're going to separate the substance or the chemical, okay, psilocybin, and now we're going to use it to treat this particular thing, bringing kind of remnants of the traditional ceremony doesn't make sense, because it's taking out, it's removing it from its original intention, from its original context, everything. So I find that problematic when there's there's like a sheen of, some indigenous knowledge wrapped in, as opposed to, as you were saying, just embracing that this is now being developed in this way. One of the things that strikes me as a huge difference is that in most traditional psychedelic ceremonies, the person guiding you through the ceremony consumes the substances as well. And that is, of course, in the Western sense, just so out of the question that if you are going to if you have a patient and you're giving them a treatment, how in the world? Like, it's just completely different. So with that divide, bringing things in from that ceremony to give it the kind of the lure of indigenous knowledge, it doesn't make sense to me.
Yeah, I've always wondered about how helpful it is. Yeah, people are going to go someplace and they're going to see a shaman or a medicine woman or medicine man, and they're not going to speak the language, and they wouldn't have been raised in that tradition with the, ideological beliefs that are embedded in it. It just doesn't seem like it's going to be all that helpful. So that's where I land on it.
Yeah, and because I have met lots of people who have benefited immensely. And that is one thing I will say, and I was talking earlier about if there could be best practices for approaching a community. So in my tradition, the Crow community, there isn't a psychedelic tradition, but we do Sundance, and that can get you into a transcendental state. One of the strongest transcendental states that I've experienced is sundancing. The community guards that tradition and that knowledge. But if someone comes and is genuinely curious and called to learn more, and they feel just something about that ceremony, I've seen the willingness to have people that are sincerely interested and come in. That has always been a fundamental part of my experience of the Sundance, is that people who come in who sincerely want to know. And I think that's something that's often overlooked about that relationship, is that, and it was true with Maria Sabina, and it was true with the colonial subjects that used to so just readily share their medicine and their traditions, is that there is a willingness to share, and it's this delicate balance between protecting, but then also sharing.
Mm. And that sounds like there's this relational piece to it as well, too. I often
Exactly.
tell my students in our family counseling class that you need to be invited into the house before you start rearranging the furniture.
Yes.
And I think that
Great way to put it.
is a good apt metaphor for what you just described. And maybe that relationship doesn't happen in a 6-day trip to the Amazon.
Yes, I would agree with that.
Yeah. Melissa, this has been an incredible conversation. Is there anything that we haven't touched on that you might feel like you'd love to share with the folks who are listening?
I think we covered it all. Yeah.
Great.
If you have any other questions, I'm very inspired by your work and by the questions that you bring up, and glad that you're contributing this to the conversation, because it's important.
I really appreciate that. And I'm just thrilled that you were willing to come in and talk and tell us about this history. We've had no one on the podcast before who has any sort of specialization that looks like yours. And so it's just been this wonderful perspective to add to the mix, and one that I've really wanted to have for a long time, because I think that one of the ways I have not adequately stepped up to the occasion is really talking about the issue of Indigenous reciprocity and cultural exchange. So thank you for coming in and articulating all of this so well. And if
Thank
you're
you so much
interested
for
in,
having me.
oh, sure. And if you're interested in Dr. Frost's work, I will put a link to her website in the show notes.
The Psychedelic Skeptic was created by me, Dr. Ann Metz. I had production help this week from Jesse Dukes. Our podcast music is by West Swing. The Psychedelic Skeptic is available on your favorite podcast app. And you can learn more at annmetz.com or follow me on Instagram at Dr. Metz. If you want to recommend a guest for the show or ask a question about psychedelic therapy, just send me a note at hello@annmetz.com. If you want to help the podcast, please share it with a friend or a family member. Or if you're feeling particularly generous, feel free to leave a review on your favorite podcast app. It really helps. Thanks again, and I'll see you next time.